But these are some of the visuals that we can now see from the meeting that the Prime Minister of India is chairing with several stakeholders, including, of course, the Union Health Minister, Mr. Mansukh Mandavia, is also present. Mr. Amit Shah, the Union Home Minister, was also present at the meeting. These are the visuals that we see from the current meeting being chaired by the Prime Minister. The health ministers of states also known to have been present as part of this meeting, where, of course, the Prime Minister has been given a detailed presentation about the prevailing situation in India with respect to COVID-19 at a time when there's a surge in cases, principally China, where the situation currently is quite alarming. So those are the visuals of the meeting that we see currently. Mayank, coming back to you, you've of course been tracking this. Tell us about the participants in this meeting. There was of course the Union Health Minister, the Health Secretary, Mr. Rajesh Bhushan, presumably is also present. The Union Home Minister was there as well. Tell us about some of the other participants.
See, Siddharth, this meeting is a high-level one, so all the members of the task force will be joining, and presence of Home Minister Amit Shah is very significant here, because remember when India enforced lockdown in the early time of 2020 when the pandemic started, so MHA was the nodal ministry that issued the guidelines on lockdowns, on containment zones, because they were responsible for policing and also, maintenance of containment zones across the country. And Health Ministry, decided the strategy to combat the pandemic. So the two ministries were working in unison, and that exactly is, being exemplified in this visuals that is coming out from this meeting, that both Home Minister and also the Health Minister Mansukh Mandavia are present in this meeting, because the Prime Minister has always maintained that all the ministries will have to work in tandem, then only a proper solution can be found. Also present in the meeting will be Ntagi Chief, the national, the National Nodal Agency on Immunization, because that is a prominent pillar. Yesterday as well, after attending the meeting with Health Minister Mansukh Mandavia, N.K. Arora, the Chief of the Ntagi, he said that that is a prominent pillar of India's fight against the pandemic. So immunization is the main factor, Siddharth, that has left India in a good position compared to China. Because what happened to China, that China did not import vaccine, the mRNA vaccines from across the different part of the world where vaccines were being produced. But India, employed the vaccine strategy quite, diligently, and that's where our country is in a very safe position compared to China as things stands now. So immunization is a very important thing. Apart from that, V.K. Paul, Dr. V.K. Paul of the Niti Ayog, he will be also in that meeting, briefing about what will be the overall guidelines given to, all the departments of the health ministry and also to the states, because they have been doctors who have practiced. They have understanding of the medical field and they have the understanding of the disease per se as well. So that's why it is very important for have a unified approach, and that the Prime Minister emphasized on since the start of the pandemic. And that's why all the members of the task force, including the Home Minister Amit Shah, the Health Minister, and also the Health Secretaries, also the additional Secretaries, Love Agrawal, who was at the forefront of briefing the media when pandemic had started in India. So he will be also giving briefing about the situation of COVID in the country. So all the members of the task force, all the prominent members who have handled the pandemic first hand, they have had the opportunity to manage the crisis in India in the various stage of the pandemic. They were present in the meeting, they have briefed the Prime Minister, and now a proper strategy will be devised from this meeting, and a proper guidelines will be issued to states and all the health departments of the states in the country.
And any clue as to how long this meeting is expected to last? Mayank, of course, this has been going on since 3:30 this afternoon. You did talk to us about a detailed presentation that's been made by the Health Ministry. Any information forthcoming about the contents of that and how long this meeting is now expected to last from here on?
Well, Well, Siddharth, it should not last long from now, from the time that we are talking. It should not be lasting for more than 30 to 40 minutes from now onwards. But about the content of that presentation, the Health Ministry is properly focusing on two things. First, that is detecting early. So what are they trying to do in terms of enhancing the infrastructure to do the genome sequencing? Because what we are also learning that one of the guidelines that the Health Ministry will issue after this meeting to the states will be the resurrection of infrastructure for quarantine and the testing facility, because you cannot enhance genome sequencing without enhancing the infrastructure for testing. And that's why, as I clearly mentioned earlier in my point, that 1% of the international travelers will be going through the random sampling, and that cannot be happening, Siddharth, without ramping up the testing facilities. Okay. So what the Health Ministry is focusing on in terms of giving presentation to the Prime Minister, that is enhancing the infrastructure once again, getting it back to the level that it was in the mid-2021.
Mayank, I have to interrupt you there because we're being joined right now for a medical perspective from Dr. Sanjeev Bagai as well. Dr. Bagai, do you think it's a situation to worry about when only about 28 to 30% of the population has been at the receiving end of a booster dose in India? And should steps be now taken to actually escalate this much more than it already has been? How is that a point of concern for you?
No, I will not be concerned. I will not be too worried at the present moment. What is critically important are three carry-home messages. One is, if you are in a closed, crowded and poorly ventilated places or in a social gathering, be it religious, political or for whatever reason, please wear a mask. The mask should be a high-quality N95 mask because this is a highly contagious version of Omicron.
Right, we'll try to patch Dr. Bagai on the line once again. Like he said, he's back. Yes, you were talking about the intensity of this particular variant of Omicron, the B7, which you earlier said, Dr. Bagai, has an R0 of about 16 to 18.
Yeah, so this is highly contagious. It can spread very fast. It has a R0 of between 10 and 18. Okay. So this is much more contagious than the initial Delta variant, although it may be less lethal. But it's a balance between being highly contagious and lethality. And if it is more lethal, more number of people will ultimately get infected. Point number two is I would urge everyone who has not got the booster to please get it done, even though it is against the original strain of the SARS-CoV-2, but it will still have a reasonable protection to prevent serious disease and death. And third is, in case you have any fever, cold, cough, sore throat, body ache, please isolate yourself and bring it to the attention of the local medical doctor. Don't self-medicate and please don't hide the symptoms.
Okay, Dr. Bagai, please do stay with us because there's a reaction coming in from the former DG of the Indian Council for Medical Research as well. And he is of the view that currently, as we speak, India should not really be panicking given what's been happening in China. We are far better placed to handle the spread of this pandemic.
जो चाइना में कोई इम्यूनिटी लेवल ही नहीं थी, लोगों को पूरा लॉकडाउन में रखा हुआ था और हमारे वैक्सीन्स भी उनसे बेटर थे. उनकी वैक्सीन नाउ टेस्ट हुई है, उसके आंकड़े भी आए हैं. उन्होंने सिर्फ अपना वैक्सीन यूज किया था. चाइना वगैरह से आ रहे हैं, उनके रैंडम टेस्टिंग स्टार्ट हो गई है. हम लोगों ने उसमें सिक्वेंसिंग फिर से स्टार्ट कर दी, इसीलिए ये 4 BF7 केसेस हमको मिले हैं. बट पैनिक होने की जरूरत नहीं है.
Dr. Bagai, just a perspective also on the state of medical infrastructure in India, because one of the the contents of the presentation that was made to the Prime Minister on the part of the Health Ministry was the emphasis that was laid on ramping up testing at a massive level in India. So where do we stand with respect to that, and is that a priority as of now?
Yeah, I'm absolutely clear that the level of infrastructure which has been built over the last 2 years, it exists, the protocols are there. It is only a question of reallocating the manpower, the resources and the raw materials, the equipment, the reagents, the testing kits to the locations. I'm quite sure that we can ramp it up within a day or so. But the important is the public health message that people themselves should come forward, get the booster, get themselves tested if they have any symptoms which mimic along the lines of a viral illness.
One other very important question, and this is something that's lingering in the minds of a lot of people who are watching you, Dr. Bagai. The word lockdown evokes all kinds of reactions, and that's something that we were, of course, subjected to for a good part of the first wave of COVID-19 and parts of the second wave, the Delta wave as well. The former DG of the ICMR did say that we are in no situation right now to be panicking despite what's been happening in China. But do you see us returning to the kind of days that we did witness, if not in the second wave, then at least the first? And do you see the governments actually exercising their authority to impose any lockdowns, or is that a thing of the past now?
Yeah, so let me assure everyone that India is in a very, very different status and situation as compared to China. The China vaccines, both the Chinese vaccines were substandard to begin with, and with the Omicron, which is immune escape mechanism and vaccine escape mechanism, their efficacy has fallen even lower. The Indian vaccines have served us very well. The efficacy was more than 90% to prevent serious infection and death. Even with the Omicron, now the newer strains, it is still holding good.
Okay.
The situation in India is very much different, and I don't foresee any lockdown, medically speaking. The purpose of the lockdown was to get our infrastructure ready, which is the first few months of the first wave.
Okay, thanks a lot for that, Dr. Bagai. We have a piece of breaking news coming in from the state of Karnataka, where another parallel meeting held to review the COVID-19 situation in the state of Karnataka has just concluded. And one piece of information coming out of that meeting is that the state is likely to introduce masking in closed spaces once again. Let me in fact go across to Deepak Bopanna for more on this. Deepak, what can you tell us about what transpired during the course of that meeting chaired by the Chief Minister of Karnataka, Mr. Bommai?
This particular meet, the Health Minister, the TAC and several other experts, of course, being there during this particular meet. Now, they have suggested that especially indoors, masking could be brought back. They're also, suggesting that the booster dose, which at this point in time stands at just about 20% here in Karnataka, priority should be given for that. But most of the guidelines that will be officially issued will be after, the central guidelines does come in. We're expecting that to happen in the next couple of hours, after which the state government will issue fresh guidelines for the next few days, and especially considering the fact that Christmas celebrations and New Year as well is around the corner, there would be probably some measures that will be taken to ensure that overcrowding there and, without any sort of preventive measures is not something that would be encouraged. And
Deepak, we did see earlier in the day the Chief Minister of Uttar Pradesh, Mr. Yogi Adityanath, issue an appeal to the public to mask up while they are in public places, though we're still waiting to see if this actually becomes a formal order. Any similar instructions on the part of the Karnataka government or prescriptions to the people of the state?
Primarily, what we are understanding now is that the expert actually, find that first starting off, they would at least hope that, masking up would be made compulsory in closed spaces. That would mean, the cinemas, it would mean malls, it would mean shopping complexes and offices as well. So this is something that was discussed. There were also other aspects which will be, put out in detail, but they're just waiting, of course, for what the central guidelines would be, because they do not want any of the guidelines put forth by the state to be in contradiction to what the centre has to say.
Right. Many thanks for that update coming in from that high-level meeting in the state of Karnataka chaired by the Chief Minister, Mr. Bommai. Vaccination is priority right now in India as well, and the nasal vaccine has been given a go-ahead. And this is another boost, of course, to the country's vaccination drive. Greater focus now on vaccination and safeguarding the public of India in multiple layers after having already administered the first couple of doses of the vaccine so far. Let me, in fact, go across to Mayank for more on this. Mayank, this is, of course, the intranasal vaccine that's being... We'll go back to our reporter in just a short while. But of course, a greater priority now on vaccination. Remember that the booster coverage in India hovers around the 28% to the 30% mark so far. And that is below par, according to a lot of experts. That needs to be stepped up. And even though there might not necessarily be an imminent threat with what's been happening in China with respect to the spread of the same variant in India, which has been prevalent around for a few months now, the priority is also, of course, shifting towards vaccinating as many people as possible in addition to the booster dose as well. So the intranasal vaccine is very much a part of that strategy. So greater focus on vaccination as well, including the administration of the intranasal vaccine. Amit joins us for his perspective on this. Amit ji, ये थोड़ा इंट्रानेजल वैक्सीन के बारे में भी बताइए, क्योंकि वैक्सीनेशन ड्राइव में एक बहुत ही इंटीग्रल एलिमेंट होगा, क्योंकि बूस्टर डोज का जो अभी तक का कवरेज है वो तकरीबन 27 से 30% के बीच है।
जी देखिए, ये मुझे लगता है कि अपने आप में एक बड़ी जानकारी है जो स्वास्थ्य मंत्री ने आज ये जानकारी दी कि जो एक्सपर्ट कमेटी जो कि वैक्सीन को अप्रूव करती है उसने एक नेजल वैक्सीन को अप्रूव किया है। हालांकि उन्होंने ये बताया नहीं कि कौन कंपनी है, क्या है उसके बारे में डिटेल, लेकिन इतनी बताया कि अब आपको इंजेक्शन से छुटकारा मिलेगा, आप सीधे ड्रॉप के जरिए उसको या स्प्रे के जरिए ये वैक्सीन होगा और ये नाक के जरिए आप कर सकते हैं। तो ये कई तरह की जो मुश्किलें आ रही थी, कई छोटे बच्चे या फिर महिलाएं जो कि इंजेक्शन की वजह से, या ग्रामीण इलाके में आप देखेंगे कि इंजेक्शन की वजह से कई लोगों ने इस वैक्सीन को लिया नहीं। तो ऐसे में ये बहुत बड़ी चीज है। और जो जानकारी मिल रही कि शायद भारत बायोटेक हो सकता है कि भारत बायोटेक को, क्योंकि पूरी जानकारी नहीं अप्रूव कराएगा, लेकिन अपने आप एक बड़ा ऐलान है, बड़ी घोषणा है कि अब नेजल वैक्सीन के जरिए भी कोविड के खिलाफ लड़ाई में एक बड़ी सफलता हो सकती है। एक बड़ी आबादी जो कि इंजेक्शन की वजह से नहीं ले पाए थे, वो भी अब इसमें शामिल हो पाएंगे और उस वैक्सीन को, नेजल वैक्सीन को एक्सपर्ट कमेटी ने अप्रूव कर दिया है।
बहुत बहुत शुक्रिया उस अपडेट के लिए अमित। विल ऑफ कोर्स